Hello everybody, my name is Iriarte, and now we're going to talk about the radial nerve and its ultrasound assessments. First we talked about the median nerve, then the ulnar nerve, and finally the radial nerve. As you know, all these upper limb nerves are formed by the brachial plexus, okay? And the brachial plexus has 5 roots from C5 to T1. The radial nerve arises from the posterior cord of the brachial plexus. The lateral cord formed the median nerve, the medial cord formed the ulnar nerve, and the posterior cord will form the radial nerve. All the roots give fibers to the radial nerve. The 5 roots of the brachial plexus from C5 to T1. Once the radial nerve has been formed, he goes deep to the axillary artery. And if we remember, the medial nerve would be superficial, the ulnar nerve slightly posterior, and the radial nerve will be on depth, underneath the axillary artery. Very soon it gives several branches, 2 motor and 1 sensory branch. The 2 motors are branches to the long head and medial head of the triceps, and the sensory branch will give recover the sensibility of the posterior side of the arm, of the distal arm. This is the posterior cutaneous nerve. And very soon it becomes posterior, and it does through the triangular interval. And the triangular interval is an anatomic space which has some boundaries. Above the teres major, medial the long head of the triceps, and lateral the humeral diaphysis. This is a triangular interval, and as you can see, the radial nerve goes through this interval and gets posterior. Okay. At this location here, it's accompanied by from the deep brachial artery, which is a branch of the axillary artery, as you can see here in the drawing. Okay, and it continues going down, and in the first place it's located between the medial head of the triceps and the long head of the triceps. Then you can see here the radial nerve between these two heads, the long head and the medial head. But then it goes down, and it will search the spiral groove. Which is exactly the spiral groove? It's a thin bone area located between the junction of the superior and median third of the posterior side of the humerus. Here, and this space, this anatomical space, is between the footprints of the medial head of the triceps and the lateral head of the triceps. This is a bony necked area between these 2 footprints, and the radial nerve will pass through this area, very close to the bone itself. So as you can imagine, when there is a fracture here, the diaphysis of the humerus at this level, the radial nerve is very close, so it could be damaged. And it separates the medial and the lateral head of the triceps. Just distally to this area, it gives some branches. 1 motor branch to the lateral head of the triceps, that's the last one which needs motor innervation, and 2 sensory branches, 1 to the lateral side of the arm and 1 to the posterior side of the forearm. Okay? So it gives sensory innervation to the distal posterior arm, the distal lateral arm, and the posterior forearm. Once the nerve has passed the spiral groove, it becomes anterior through the lateral fascia. But this lateral fascia is not very known, but this is on 1971, Lotten described a fibrous arch in the lateral head of the triceps here, and the nerve radial passed through this fibrous arch. So this is known also as the lateral fascia, and this is another potential place of entrapment of the nerve. Okay? So be always aware this passing this path of the radial nerve through the lateral triceps. And this is all the place when the radial nerve becomes anterior. So it was in a posterior position, then it penetrates the lateral fascia and the lateral septum and becomes anterior. Now we are very, very close to the elbow. And at this place, it will be located between the brachioradialis and the brachialis muscle. This is the brachialis, this is the brachioradialis, and the radial nerve will be between these two muscles. Now we are at the elbow, and it gives several branches. To the extensor carpis radialis brevis, to the extensor carpis radialis longus, and to the brachioradialis. These are motor branches of the radial nerve. The radial nerve has a function, his supinator and its extensor. Okay, so all these extensor muscles will be innervated by the radial nerve. Okay, and now we are going to talk about the ultrasound. We have just checked the anatomy, and now the ultrasound assessment of the radial nerve at the axilla and at the arm. And as you remember from the other videos, when we are talking about nerves in the upper limb, always we begin at this axial cut here, this axial plane at the anterior side of the elbow. And once we place the probe in the anterior side of the elbow, we will notice this bony contour of the humerus, distal humerus, with the medial epicondyle and with the medial condyle and the trochlea here, and this muscle with this triangular shape will be the brachial muscle. If we are medial, this is the pronator teres, and between the brachialis muscle and the pronator teres we will find the medial nerve here, and between the brachial muscle, the brachialis muscle, and the brachioradialis, here in this fascial plane we will find the radial nerve. In this case, the radial nerve is divided into three branches, but if we follow these branches slightly proximal, we will notice that they join in a unique nerve. Okay, the radial nerve is very complicated to follow because it's, first of all, he's deep in the axillary area, then it's posterior in the arm, and finally it goes anterior in the elbow. So it turns and it has a very complicated path. So to follow this nerve with the patient is not easy. If we want to follow the nerve proximal, then we start in the, it's better for me to place the patient in a supine position and going from the anterior side of the elbow to the axilla through this posterior area. But usually I ask the patient to be seated with an eye in the posterior side of the patient, and usually I manage quite well. But just for understanding purposes, we have placed this image here, and we start here, and we will go first of all lateral, okay, because the radial nerve goes from anterior, lateral, and then posterior. So in distal area, the arm, we will be lateral. And when we are lateral, we will notice that the nerve is located between the biceps and the triceps, lateral half of the triceps. And this is the lateral septum. And if we are distal, the nerve will be anterior to the lateral septum. Here, this is the biceps, this is the triceps, okay, and the nerve is here, anterior to the lateral septum. But if we follow proximal, and that's now we need to be at the posterior side of the patient because the nerve goes very posterior, okay. So at this place here with the probe located here, we will notice how the nerve becomes posterior, perforating this lateral septum. And it searches the posterior side of the bone, very, very close to the bone, to the cortical of the bone here. Okay. Now we are posterior, this is the anterior, the biceps, this is the triceps, and the nerve will be located here, stuck to the bone. Okay. And remember that these are the lateral head of the triceps, this is the medial head of the triceps. Okay. Now we are on the spiral groove between these two heads of the triceps. If we continue proximal and reaching, almost reaching the axilla, then we notice that the nerve is becoming to get separated from the bone. The nerve is leaving now, because we are from distal to proximal now, okay? And the nerve is leaving the spiral groove and is passing. This is the deep brachial artery. This is the nerve which is going from deep to superficial between the long head of the triceps and the medial head of the triceps at this level here. And this nerve will search the axillary artery. This is the deep brachial artery, a branch from the axillary artery. Sorry, in the drawing, the nerve will be located here. This is the axillary artery, this is the medial nerve, okay? If this is posterior, this is the cubital nerve, and this is the radial nerve. Okay, it's slightly complicated, the path of the radial nerve in the proximal arm, of the arm, sorry, but we are now we will watch a video explaining and showing all these movements of the radial in the arm. So pay attention. Okay, we start at the elbow in the anterior side. Okay, this is the brachioradialis, this is the brachialis muscle, and let's see what happens with the radial nerve. Very soon it becomes lateral. Okay, here, as you can see, we go again here, we follow proximal, okay, and this is lateral. This is the lateral septum, and the nerve is anterior. This is the biceps and triceps, lateral head of the triceps, and it's anterior to the septum. If we continue proximal, then it perforates the septum and becomes posterior again. Now it perforates and it enters the spiral groove here, very close to the bone, the cortical of the bone, and between the lateral head of the triceps and the medial head of the triceps. This is the spiral groove. Okay. Then, if we continue proximal, it leaves the spiral groove and searches the location between the medial head, which is this is very close to the origin of the medial head. It's why it's so small, and this is the long head, and the nerve passes between these two heads, medial and long head, when we are proximal, and will search the axillary artery. So now we are very close to the axilla, and we are noticing how the nerve searches the axillary artery here and there, here. And now it's located here, deep to the axillary artery, okay? And this is the superficial nerve, would be the median nerve, and this is the posterior nerve, with the ulnar nerve, okay? And inferior on depth, the radial nerve. Okay, I know it's slightly complicated, but I hope you understood. Once the radial nerve has passed the arm, he goes to the elbow, to the anterior side of the elbow, to the anterior lateral side of the elbow, and is located between the brachialis and the brachioradialis muscle. This is the brachialis, this is the brachioradialis muscle, and between them, this is the radial nerve. Usually, at this level, it divides in several branches. The most important branches are the deep branch of the radial nerve and the superficial one. Okay, first we are going to examine and to follow the deep branch, and after this branch we will go through the superficial branch. Let's go to the deep branch of the radial nerve. This deep branch passes underneath the arcade of Froese. This arcade of Froese is a fibrous arch between the two origins of the supinator muscle. The supinator muscle gives this arcade, and is a very common site of entrapment of the deep branch of the radial nerve at this area, this location. As you can see here, the nerve penetrates into the radial tunnel. This is the arcade of Froese, and this is the radial tunnel between the two portions of the supinator muscle, the superficial and the deep portion of the supinator muscle. Once the deep branch of the radial nerve penetrates into the radial tunnel, it becomes the posterior interosseous nerve. Here you can see the supinator muscle in its axial plane, and this is the nerve inside the supinator. As I told you, now it becomes the posterior interosseous nerve and leaves the supinator in the posterior side of the arm. So it enters into the supinator in the anterior side and leaves in the posterior side. And it's located between the superficial and deep layers of the posterior forearm muscles, and innervates. This is a motor nerve, and it innervates the superficial component with the extensor carpi ulnaris, the extensor digiti minimi, and the extensor digitorum communis. But it innervates also the deep components. This is the abductor pollicis longus, the extensor pollicis longus, the extensor indicis proprius, and the extensor pollicis brevis. All these muscles, all these extensor muscles are innervated by the deep branch of the radial nerve, the posterior interosseous nerve. Then this branch, the posterior interosseous nerve, becomes deep between the abductor pollicis longus and extensor pollicis longus, and reaches the interosseous membrane and continues distal till it reaches the wrist and finishes giving sensory proprioception to the dorsal capsule of the wrist. Okay, this is a motor nerve, but it gives sensory proprioception of the dorsal aspect of the capsule of the wrist here. And we will see this nerve ending underneath the fourth compartment at the wrist. So, how are we going to see these structures with the ultrasound? We begin at the elbow, in the anterior side of the elbow, always searching this image here with a cortical, with a good view of the cortical of the distal humerus. This is the medial epicondyle, this is the condyle, sorry, this is the trochlea. So this is medial and this is lateral. This is the brachial muscle, and between brachialis muscle, sorry, and between brachialis and pronator teres, this is the median nerve. And between the brachialis and brachioradialis, this is the radial nerve, which is beginning to divide into several branches. We will follow the deep branch and see what it happens. Now we arrive to the supinator muscle here, and we see the deep branch just is beginning to enter into the supinator muscle. This is the brachialis, the brachioradialis muscle, and this is the extensor carpi radialis longus. Brachioradialis and extensor carpi radialis longus. Okay, so this is the nerve just at the beginning of this entrance into the supinator muscle. So this is the arcade of Froese. Always check the nerve here. This is the most important area to check the deep branch of the interosseous nerve. If we continue, this is the deep branch, we will notice how the nerve goes inside the supinator muscle, and you can see here there are two images here, two branches, two small branches of the nerve. And if we follow, it's important to place the patient in pronation. I'm sorry, this image is in supination, but if you want to follow the posterior interosseous nerve, you must place the patient in a pronation, because as I told you just before, the interosseous nerve becomes posterior. So it's easier to find, it's mandatory to place the patient in pronation to have a good view of the posterior area of the forearm here. Okay, and you will notice here the nerve between at the exit of the supinator muscle here and below the superficial compartment here. If we follow the deep branch, we will notice how it becomes deep, reaches the interosseous membrane, and ends just below, underneath the fourth compartment here, usually with a small artery, which is the posterior interosseous artery. And this image is not always easy to obtain, because this is very small nerve with a very small artery, and usually sometimes it's difficult to see. Here you have a good view of both of them. And now we are going to check all this path of the posterior interosseous nerve with a video. Okay, we start at the first location, at the humerus, distal humerus location. Okay, so this is the brachialis muscle. If we go medial, we can notice the brachial artery and the medial nerve. So this is the pronator teres. We go lateral. So this is the brachioradialis. This is not the radial, this is the brachioradialis muscle, this is the brachialis muscle, and the radial nerve between these two muscles, dividing into two branches. We are following the deep one, this here, and notice how this branch penetrates the supinator here, the supinator muscle. So the location where the nerve is beginning its entrance into the supinator, this is the arcade of Froese. Okay, if we follow the nerve, we can notice how it's between the two portions of the supinator muscle, and always in pronation it becomes posterior here, and this is the exit of the nerve here. And now it's located between the superficial and the deep compartment of the forearm. And if we follow, we will notice how it goes between the abductor pollicis longus and extensor pollicis longus, passes between these two muscles, and will reach the posterior interosseous membrane here. It's difficult to see because, sorry, okay, here, you can see here, and there it is. I will repeat this last movement. This is the posterior interosseous nerve, and you can suspect this movement joining the posterior interosseous membrane. It's difficult to see this movement of the nerve because it's going away from the probe, and it's very deep and it's very small, so it's very difficult to see the pass from this location between the superficial and deep component, layers of the muscles to the posterior interosseous membrane. It's difficult to see. We know we may search the artery, the posterior interosseous artery, and we can use the Doppler, but it's always difficult to see the nerve at this location. Okay, this was the deep branch of the radial nerve. And what happens with the superficial branch? Okay, this one is a pure sensory nerve, and if we search underneath the brachioradialis muscle, it will be there. But as it names is telling us, this nerve will be superficial, so it becomes superficial going through the fascia between the brachioradialis muscle and extensor carpis radialis longus, usually 9 centimeters proximal to the radial styloid. At this location here, between these two muscles, perforating the fascia between them, is a potential location of entrapment. And the pathology here of the nerve will be called the Wartenberg syndrome. So it's important to check always this area where the nerves become superficial, perforating this fascia. Once he has got superficial, it continues, and reaches the anatomical snap box between the first and second extensor compartments of the wrist. In this path is crossed by the cephalic vein, and again this is a potential location of problems because of the catheters, blood catheters located here. You can imagine the nerve may be damaged when we insert the needle, okay? And it gives innervation from dorsal skin of the hand, dorsal and medial skin of the hand, of the first, second, third, and fourth fingers, okay? The medial surface of the hand belongs to the cubital ulnar nerve, and the distal tips of the fingers belong to the median nerve. And to finish the radial nerve, we are going to check this superficial branch with the ultrasound. We again start at the elbow, always checking this image, brachialis, brachioradialis, radial nerve here in the medial, in the lateral side of the elbow. And if we follow the superficial branch, we will see how underneath this muscle, which is the brachioradialis, we will find a nerve. This is the superficial branch of the radial nerve. If we continue distal, we will notice how the nerve penetrates the fascia between the extensor carpis radialis longus and brachioradialis muscles at this level and becomes superficial. And distally, it will be very, very close to the cephalic vein, which just in this image, at this distance, so distal, the cephalic vein has just crossed above the nerve, okay? And this is the first compartment and the second compartment of the wrist, so we are in the snuff box, okay? And this is the radial nerve, very, very superficial. And once again, what can we see in a video of these structures, okay? We begin between the brachial and the brachialis and brachioradialis muscle. We will follow this branch here, always related with the brachioradialis muscle here, and becomes superficial. Here it goes superficial, and between the brachioradialis and extensor carpis radialis longus, it penetrates between them here, perforates the fascia here, and becomes superficial. You can see here the cephalic vein and how this vein crosses above, okay, the nerve. Here this is the crossing of the vein, and how the nerve is located between the first and second compartment of the wrist. Okay, so this is the third and final video of the nerves of the upper limb. I hope you like it and you enjoy searching the nerve on all these branches and you find it useful. If you like the video, just check the like, and if you want to be informed about new videos, subscribe. Thank you very much.